a suicide bombing. Victims are rushed to hospital. It's a race against time to save this man's life. Doctors discover a dangerously fast heartbeat. Their decisions, their teamwork, will determine whether he lives or dies. Teams trained to save lives at Messer, the Israel Center for Medical Simulation at the Sheba Medical Center, Tel HaShomer. A computerized mannequin shows signs of an accelerated heart rate. The team works to stabilize the patient. He goes into cardiac arrest. Potentially fatal errors occur.
Everybody clear?
The defibrillator fails to work, but the patient is saved. The simulation is videotaped. The team debriefs and reviews their errors.
The whole idea of simulation is to allow us to train ourselves on the alternative to the real patient, make sure that we make most of our errors in a safe environment where it's safe to make mistakes, and hopefully to produce, so to say, better practitioners that would be facing these problems with better competencies.
Messer is the most comprehensive simulation center in the world. Many simulation centers seek their advice. Over 20,000 healthcare professionals have trained in the past 4 years in clinical and communication skills at Messer. Messer is a leader in preparing for many challenges, including unconventional warfare. The concept is revolutionary. Pilots train in simulators to prevent air crashes. But physicians traditionally train on live patients. Over 100,000 people die in U.S. hospitals alone because of medical errors. Lives that could be saved by training in medical simulation centers like Messer.
If you take it into aviation figures, we're talking about a Boeing 747 that crashes into the ocean daily in the American hospitals only. And this would be because of the wrong drug, the wrong dose, the wrong procedure, or the wrong patient receiving the wrong treatment. The whole idea of a simulation center is to take advantage of errors and to make it a very constructive environment in the educational aspect.
Back to the ER. Doctors perform a diagnostic ultrasound on another wounded patient from the bombing. They discover internal bleeding. He urgently needs surgery. At Messer, medical and surgical teams practice these procedures. Laparoscopic surgery diagnosed. The surgeon is surprised to discover massive hemorrhaging. The team immediately reacts. Opening the stomach, they manage to stop the bleeding. They pull out shrapnel. At Messer, healthcare professionals also work on improving communication skills. Over 100 actors take part in Messer's programs. This is the concerned wife of the bombing victim. Meanwhile, other trainees observe and learn through a one-way window. The surgeon eases her worry. Her husband will survive. Messer simulates a broad range of medical challenges. A seizure grips this child. A pediatrics team stabilizes him. They suspect a head injury and potential use. Messer emphasizes the humane message. Healthcare professionals trained to deal with challenging situations. In this simulated encounter with the parents, the suspicion of abuse is reinforced.
פשוט תסתמי את הפה.
בוא תקשיב רגע למצב.
I certainly believe that Messer has a message that applies worldwide, not only in Israel. It's a message of safety. It's a message of quality. Messer is, in fact, a revolutionary vehicle towards making healthcare system more effective and more humane.
מצוין. He's okay now.